Uh, from diagnosis, which is probably for many people will be with their gynecologist, their primary care physician, to getting to the oncologist. This for me was a very complicated road because of um, uh, the office that I go to and because of my insurance company. So I'm just going to explain this because um, along the way, if I didn't have the support system I had with a friend who had been through cancer, through my husband, who was really helpful in all of this, I could see me almost giving up, going, I don't know how to do this, or I could certainly see somebody doing that. So in my particular case, I have insurance that my primary care doctor has to give all referrals. Um, so this complicated things. The other thing that complicated things, a couple of years ago, my gynecologist, who was a woman, retired. I couldn't find another female gynecologist, is what I prefer, who was taking patients. So I went with a midwife, whom I've had a very good experience. The problem was, for me, when I had my appointment with her and told her these symptoms that were going on, she sent me for the vaginal ultrasound, but the biopsy could not be done by her. So the doctor that performed the biopsy was someone I had never met before. And that was also the person that called to give me the results. Um, Honestly, when she gave me the results, the phone conversation probably didn't last longer than 60 seconds. She talked so fast, I had no idea what she was talking about. And I didn't have any personal relationship with her, nor her with me. So it was very impersonal. Um, uh, Really, I only understood what was going on. The pathology report was left at a front desk with me. The only recommendation or referral I got from there was go to listed of 3 hospitals. That was it. There was no doctors, there was no nothing, there was no anything. So I had to look on my own. I did get help from a friend who, through somebody she know, got a couple of referrals. Unfortunately, my insurance didn't participate with those physicians, or those physicians didn't participate with my insurance. So that was the whole insurance thing becomes very complicated. And then one place that I called, uh, they they said, okay, we'll check into it. They didn't get back to me for 2 weeks. In fact, they didn't get back to me. I called them and said, hey, what's going on with you guys? They said, oh, we don't take your insurance. Like, oh, well, that would have been nice to know. That was MSK. I did have a very different experience with Mount Sinai, which I called Mount Sinai, and the doctors I had, they said, they don't take your insurance, but let us look and see if we can find someone that does. And they did, in fact, do that and called me back. It was within a week that they called me back. Now, the other complicating factor was I could not go to see them because I needed a referral from my primary care physician. Other complicating factor, my primary care physician had left the practice. So I had chosen another primary care physician, but had never seen this person. And it all seems a little silly to me that that was the same office that I got my pathology report done. The pathology report is listed on my chart, that electronic chart, the patient portal, is listed there. Same office that I have a primary, that I'm picking a new primary care through, but I could not get that referral without having an appointment with this other primary care doctor, which I then had to pay a copay to go and see. All really crazy. And so I first had to get an appointment with her. Now, when I first tried to get an appointment, there were no appointments available. My husband, thankfully, went on, and one showed up when he went on, like the next day. It must have been somebody canceled and grabbed it for me. So I was able to get in there. But I could not get in to see an oncologist until I had that referral, since my insurance company required that. So this was such a tough swim getting there. Now, once I got to my first appointment with my oncologist, Dr. Caitlin Carr, um, uh, that was great. She was great, and ultimately, she was the right doctor for me. I have concerns as a fitness professional that may be different, and then some people going in having to have a hysterectomy. Um, and because she herself was an athlete, played soccer at the college level, you can see she's fit now, had a true appreciation for my concerns as far as strength and fitness, that was not only about taking care of my body, it was also about my livelihood and, my profession and inspiring other women. So she could appreciate where I was at, mentally, and some of the questions that I had for her. Now, I will tell you, the other aspect of this is, because, as I said, I was given my pathology report basically in an envelope left at the front desk. Um, I was kind of ill prepared for my first appointment with her. I didn't have anybody from that office guiding me. I'd sent some emails and didn't really get a lot back. I got some general stuff back. So I was uncharacteristically ill prepared. I thought when I went to see her, she was going to say, well, we'll do some testing and then we'll give you some options. I didn't think that it was going to be so definitive. Um, so I'm very fortunate in her, because when she asked me at the end of the appointment, do you have any questions? I was a little bit like, I couldn't wrap my mind around it yet. So I was very fortunate in that when I could wrap my mind around it, when I did research and could see this was the only procedure anybody was going to do on me at where I was at, what was being shown on my pathology report, I I did contact her office, and she got on the phone with me, which was really helpful for me to get these questions answered. So finding that right surgeon is really important. Gave me a lot of trust in her. And the day before, when I was thinking I can't do this, the only thing I trusted in was I trusted her, that she would do the best for me that she could.